In the past 25 years, the Suncoast has completely transformed from a quiet beach community of less than 100,000 people to a sprawling area of hundreds of thousands, plus a vibrant snowbird population. Medical facilities are a crucial part of our growing community, and Intercoastal Medical Group has been here through all the changes. One of the founding partners, Dr. Randy Powell, joins us to talk about the transformation. Welcome. So Intercoastal Medical Group began back in 1993 as a physician-owned practice. Tell us what that means and about your original group.
We had a group of doctors that were all in small groups, and with the pressures that were going on in the community to bring in more technology, and the computers were coming into the practice, we had to look at it differently. So we merged multiple practices together and started a family practice, an internal medicine group.
So 19 became one. From that original 19, how many doctors and staff are you now?
Oh, we've grown immensely. We have 45 primary care doctors and 44, or around that number, of specialists, and we've got another 6 coming this year.
So more than 100 physicians. I read that your staff number is over 600. Obviously, therefore, you need lots of space to do all of this. But you mentioned specialists. Obviously, our area has changed, and our area is unique in many ways. Which of the specialties were first to arrive and fastest to grow?
Well, we've had a number of specialties that have been added as the need arises for our patients, but cardiology and gastroenterology have been areas that have grown the most and most rapidly.
I think one thing that you've been able to do as a physician-owned practice is respond to whatever needs the community might have had. Since you explain to everybody so they understand physician-owned. Does that mean you are not affiliated with any particular hospital? And how does it work when you need to work with a hospital?
Right. We do not have any ties to any one particular hospital, but the 3 local hospitals, we go to all of those, and they're exceptionally good hospitals. We have wonderful health care here in Sarasota. So we can access any of those hospitals, and all of our specialists are involved on the medical staff as well as the primary care.
Well, one thing you've been able to do, I know, with the increase in your numbers is also then increase your care centers so that there are times you don't even have to go to the hospitals. Tell us about the different buildings and ambulatory centers and what that all brings to the practice.
That's grown immensely as well. We have 8 buildings now, going from Lakewood Ranch down to Palmer Ranch, and we have ambulatory surgery center, and we have diagnostic centers in those buildings, and we try to match the growth of the population with what their needs are.
Physical therapy as well, right? I know that
That's correct.
25 years ago, I mean, I'll be honest, I was in college and they said, go into physical therapy, that's going to be a growing field, and you all built a center just to do that for your patients.
That's correct, yeah. When we see a need in the outpatient setting, then we try to match that up with what the population needs.
And I'm sure the population appreciates the, accessibility of various centers rather than having to use a hospital for everything.
I think so.
All know that can be tricky.
What about technology?
Yes, because
how has
technology
technology grown in the 25 years? You have an MRI machine, I understand?
That's correct, yeah. We have a lot of ancillary technology, and this one in particular is one of 2 in the U.S. that are available right now.
What can you see with this or diagnose with this that you might not be able to with other machines?
Well, part of it is that you can go into different areas like the prostate and breast and get a much more detailed picture of what you're dealing with, and so it has helped immensely with
oh yeah, you don't have to go somewhere else the next day and get your test.
That's correct.
Yeah, it is definitely nice when your physician center can handle everything, and I'm sure that helps with records too. Now, we talked earlier about how Kelly's company has spread north into Lakewood Ranch. Everything is spreading that direction. Tell me about the inroads you're making east of I-75.
Well, we're trying to go where the growth is, obviously, and supply the medical care to those areas, and Lakewood Ranch is booming right now. So we have been, we built a 2nd building out there and trying to man up for all the people that are coming.
They certainly are. I know you don't have a crystal ball, but if you can look ahead into the next 25 years, What are your goals as the Suncoast changes and the medical treatment world changes?
Right. You do need a crystal ball because there's hard to know exactly what's going to happen there. Technology is obviously going to continue, and there's going to be more emphasis on the testing and less emphasis on things like personal touch, and those are the things we have to keep in mind.
That's important.
Very important.
The personal touch is very important.
Yeah, it's a hard
me.
balance, the
Yes,
technology and the personalness of it, because you started very personal 25 years ago. Well, congratulations and happy 25th anniversary to Intercoastal Medical
you
Group.
very
Quite
much.
an accomplishment. For more information about all the different services and facilities they offer, you can go to their website, intercoastalmedicalgroup.com. Coming up next, a musical performance you might have missed.